Hi guys, this is Dr. Leslie Blevins with Enilda Clinic, and today I'm going to be talking about evaluations for your kids. It's that time of year. You're starting to go to parent-teacher conferences. Some of you guys are starting to get feedback that maybe your kid needs a little bit of extra help. Maybe even the teacher has said that your kid should get evaluated, or maybe even like a screener or something like that, in order to figure out how best to support your child. So what I'm going to chat about today is what you should think about in that process. Lots of little things to consider. I'm going to mostly be focusing on if a parent wants to do an evaluation outside of the school system or in addition to the school system evaluation. Before we get started, make sure you hit subscribe on YouTube, or if you're watching this at enildaclinic.com, sign up to get more learning videos in your email. Okay, guys. So, first off, what I usually hear in the story of how a child's concerns develop, if it's happening from a parent-teacher conference, is that there's a particular concern, whether that is the kid's reading scores or their math scores, or the teacher feels like the kid isn't paying attention well, or they're interrupting other students. There's usually some very specific behavior. What I want to let everybody know is that that doesn't mean that we know what the problem is. Okay. The problem could be language development. It might be a reading deficit. It might be anxiety. It might be depression. It might be bullying. There's so many things. There's so many things. And so the way that the problem is starting to present, if this is your first time as a parent getting feedback that your kid is having difficulties, that's sort of like the symptom. But what is most helpful in an evaluation is figuring out what is the cause. Sometimes those two things are different. So just because you're told your kid has reading difficulties doesn't mean that the cause is a reading disorder, or it's not necessarily the only thing. So an evaluation, let's talk about that. So sometimes, most often, what the school is going to do is start the multi-tiered systems of support. What that means is that they're going to do some screeners to see where the child's deficits are, and that should be academically and socially and emotionally. And then if the child does have deficits, they're going to provide this next tier of support for your child, and wherever those screeners say that there are deficits. If your child isn't responding to those interventions, then they might start doing testing for additional higher level interventions, specialized support, specialized instruction, modifications to the curriculum. All of that means special education. It can be quite a process. It can last an entire academic year, and I've definitely heard from the vast majority of parents I've worked with that it's a frustrating process because it does take so long. The nice thing about the process is that if a child just needs this level up of intervention that could easily be done in a gen ed classroom, then this process is likely going to get them that. The pitfalls, from what I've seen in schools that I've worked in as a school psychologist during my training in graduate school, was that oftentimes the symptom that's being identified by the instructors, by the people at the school, the teacher mostly, is often not where the core deficit is. So let's take math, for example. If the teacher's identifying, gosh, this kid just keeps getting math problems wrong, and so we do a screener, yeah, they're getting math problems wrong, let's start doing some math interventions. And it works all the way up to then doing an evaluation, and the evaluation actually shows, hey, this kid has executive function difficulties, AKA probably ADHD. Schools don't diagnose, but probably ADHD. And whenever we look at their math skills, those really aren't that bad. They might be a little bit low compared to their peers, but not significantly lower. So we've just wasted months doing interventions on the wrong core deficit. Super frustrating. Now, as an aside, that should not prevent a student from then proceeding into special education to get those more rigorous interventions, those specialized teachers, those additional supports in the classroom. But I have seen schools delay that process so they can do another round of interventions targeted now at the correct deficit. Just depends on the school system, how much support and expertise the school system has going on in it. So with all that said, let's talk about what happens in a private evaluation. These are nice because in these evaluations, we are taking the information the school gives us, which is so valuable, right? We want to know how the child's deficits present in different environments. So I am trained as a school psychologist. So I've worked inside the schools. I've worked inside different types of clinics, behavior clinics, psychology clinics, and private clinics everywhere. And so learning how to take data for how a child presents in different environments, including the home, which oftentimes the school isn't taking into account, maybe they are right now because of the pandemic, hopefully they are, then we start to understand a little bit more of the nuance of what's happening with the child. This is especially important for things like autism, spectrum disorder, and anxiety and depression. So those things that are getting a little bit under the academic difficulties. And also, these are the things that sometimes fly under the radar unless a child is having, lots of behavior outbursts, interrupting the class, disturbing other students. If your kid isn't doing those things, but they're having difficulty, they come home after school and they're wiped out and they might have a tantrum, they can't get through homework, things like that. The school might not see that, but there's still some impairment there academically for sure, but absolutely social emotionally there's impairment there. And so private evaluations will tend to go a little bit deeper into those difficulties and account for the context in which students demonstrate those difficulties a little bit more, in my experience. Some school districts do a good job there too, I would think. So what to look for in evaluation. This is the number one thing. This is the most important thing, is that when you call a psychologist's office and you are requesting an evaluation, the concerns that have been brought up, you really ask if that psychologist has training to do an evaluation with your child. So for instance, I do evaluations starting at 2 years old. Not many psychologists start that young, but there are some psychologists that do. Interestingly enough, school psychologists are the ones who tend to be trained to work with children down to 2 years old. Not many of the other types of psychology tend to be trained for that young. School psychologists tend to work with children 2 to 22 years old. And so I've had tons of experience with the young kids, 2 to 7. And most of the psychologists I know now in my professional world, they might have had clinical psychology degrees or neuropsychology training and specialization, and those don't typically train to that young of an age. That's really important information because that person might not have the specialization to actually evaluate your specific kiddo with their specific needs. So, next point. What if your kid has a very specific presentation, like you're considering autism? I'll just be really frank. I think autism is a special situation for evaluation. Not everybody has the training. Sometimes in psychology world, we are assessing for things that we see pretty rarely, and we're getting consultation from our colleagues to make sure that we're doing a good job. I would say autism is not a very rarely type of evaluation. I'm doing it all the time. At this point, I would say I'm probably more of a specialist in my area for it. But my point is that you want someone who has good training in autism if you are concerned about autism for your child. You don't want someone who has never worked with a supervisor who had specialization in autism, or who has never worked with children who have autism. You really want someone who understands what autism looks like and what it doesn't look like. That's my biggest pet peeve with evaluation, I would have to say. So yeah, so those are two big questions. One, do you have specialization with my child's age range? And two, do you have specialization or at least experience with the difficulties my child is presenting with? And so as you can imagine, let's take another example, a kid that's super young, a 4-year-old throwing tantrums and destroying a room. That's not a kid that I want to be evaluated by just anybody. That's a kid that I want that psychologist to have a good skill set for interacting with that kid in order to reduce the inflammation of the misbehavior and really get to the core cause of the misbehavior. And then going into some of your more academic concerns, reading disorders, math disorders, writing disorders, anything like that. I think that, those are pretty standard things that most psychologists can diagnose. But the key here is that we're not missing something that's in addition. So we're not missing underlying ADHD or an anxiety disorder, depression, anything like that contributes to the academic impairment. Or like a fine motor coordination disorder, anything like that. And so I think that's why the comprehensive evaluation in the private setting can be really advantageous as an addition to the school's evaluation. The school can do a lot of the basic testing, and then you can have a reduced evaluation in the private setting, or you can just have everything done in the private setting if you want. And that way you get a more comprehensive picture and recommendations to support your child. And then the last thing that I would say is that the school is using IDEA, the federal framework for disabilities in education, in order to identify your child. A big piece of feedback I get from parents is that their child was tested by the school and there was nothing found to be wrong, but their child is having significant impairment and it's disrupting the home life. Their child is really upset, emotionally distraught. That is impairment. Medically, that's impairment. And so the medical model is used in the private setting, totally different model. So if your school evaluation didn't render any kind of positive result telling you what to do, what's going on, how can you support your kid, how can the teacher support your kid, that's probably because the bar is really, really high that the kid has to meet as far as having a distinct difficulty in school. That's what IDEA is trying to get at. But in the medical model, we're using DSM, and we're really looking at impairment in your ambitious functioning and like what can you ideally achieve, right? We're not looking at what's like this lowest level of acceptability and achievement, which is IDEA. We're looking at what is your potential to achieve, and are you having difficulty there? Is there something that's holding you back there? And is that causing you impairment? If there is, maybe it fits with a disorder that is identified. So I hope that all of this is helpful as you guys are going through parent-teacher conferences. I know this is a hard year. Hopefully this makes it a little bit easier. All right, guys, I will see you again next week, and have a great week. Make sure you sign up for the newsletters weekly, and also make sure you sign up for my new Facebook interactive group, Positive Parenting Q&A. That's the name of the group at Facebook, where I am answering questions from parents every Wednesday at 4 p.m. Pacific time. See you there. Bye.